Welcome to 6 Million Seeds. I'm Meryl Fury.
And I'm Carrie Bruno. We are healthcare professionals and co-creators of this podcast. This episode is brought to you by the power of education. In today's episode, we talk with Dr. Tara Cannon. Tara is a doctorally prepared nurse with a passion for education and health. She's been plant-based since 2017, and that came from simply wanting to have a healthier pregnancy. Since this change, she has noticed many health benefits, such as weight loss, having more energy, improved mood, clearer skin, just to name a few. Nonetheless, her daughter was diagnosed with a chronic illness and her son a developmental delay. She has seen both of them achieve and maintain improved health because of this lifestyle. Dr. Cannon is so bold as to say this lifestyle can close the healthcare disparity gap that many experience. So with all that in mind, her goal is to empower and develop individuals through education and health. This is exactly what we hope you gain from today's conversation. We hope it leaves you feeling hopeful and empowered to make positive lifestyle changes in your life and in the lives of the children around you.
Welcome, Dr. Tara Cannon.
Thank you for having me.
We are thrilled to have you. Thrilled. So we'll get started. We'll jump right in.
Yeah, so tell us a little bit about your background.
My background is that of a registered nurse. I work the hospital floor just like many do. And after a while, I was noticing, my patients are really being diagnosed with the same thing. Sometimes I would get report from the other nurses and I would go ahead and write down coronary artery disease, hypertension, and diabetes because that's what the next person in the room would have. And after a while, just started getting really passionate about food and reversing people's illnesses with food and seeing that the hospital setting was really coming short of that. I taught nursing for a number of years also after working the floor. And so it was just sort of a natural transition that now I'm able to focus on my business of really getting people to reverse their illness through plant-based eating.
Nice.
So tell us about your business. What do you do on an average day?
My business, by the way, has been in existence since July of 2020. So I am really still in a startup phase. As you know, Meryl, you're farther along than that.
Yeah.
So we're still working on keeping maintenance on the website. We're taking in consultations for clients who might be interested. I do a free 10-minute call for anybody interested in my service. I'm very active on Facebook. In order to be a competitor in this industry, you have to have a social media presence. So I maintain those platforms. So that's sort of my day-to-day routine. And also I homeschool. So, I kind of start the day running, after my workout, it's homeschooling, get the kids with their assignments and get things taken care of for my business. But like I said, having that social media presence and consistently posting. I do have a Facebook group called Health and Wellness for the Believer. So that's the outstretched arm of Tara Cannon LLC. That's how I reach out to the communities. The three services that I offer, of course, health coaching is the primary service. That's where I bring in most of my, profit from. Professional nurse tutoring is something that I offer. Like I said, with the education piece, I'm passionate about that, especially with at-risk students. And then now food for life classes. So that allows me to also reach out to my community, and I'll do those virtual and in person. I have several scheduled in the next few months. So I'm excited about that.
Congratulations.
Yeah.
That's exciting. Yeah. That's how I met Tara. She and I were in Food for Life class together. So
Yes.
Very cool. Really, really good.
So going back a little bit, how did you eat when you were growing up?
First of all, I am from the South. I did have some time that I spent in Chicago, and now I've relocated again because my husband's military. But I had sort of your traditional Southern soul food meal. In the morning, my mom would do grits and bacon, and it was like, no, you were expected to eat that. But I noticed that as I was a senior in high school, I was starting to I don't want to say rebel, but I thought, man, I don't feel really good after eating this food. I don't want a big plate of grits this morning. And but I started to gain more freedom, of course, when I went to college, started eating a little differently, but never quite, understanding that, hey, no, this food thing is really driving your whole, well-being. And
Mhm.
so I would say it was just sort of a natural shift. So no, we ate, if it was fried, we would eat it. And I remember my mom making the switch from lard to regular oil. And I thought telling her, Mom, they're saying that that's not good anymore to fry your chicken like that. So she did make, changes as, we received more education. And I did not grow up, I wouldn't say well off, but I didn't know I didn't have, if that made sense. My mom was on food stamps. We had government aid for a while until she worked. So the sort of culture of that time was people bringing in all these sort of packaged and processed foods, because that meant you went grocery shopping and that meant you had enough food for your kids. So that was sort of the mindset. So yeah, I'm a real outsider now, sort of with the family, but they're catching on. They're catching on. I have a twin brother that just transitioned to a plant-based diet. So my family, they're catching on. They're catching on and they're open. So
That's good.
Yeah, that is good. That's terrific. I know when I was growing up, like I said, I wanted to see if you ate the same way I ate when I was growing up. Because my mom, even though she wasn't from the South, she grew up in New Jersey,
oh
but her parents were from the South.
yeah,
And she certainly cooked hog maws and chitlins and pig feet and all of that.
yeah,
And I certainly ate that when I was growing up.
yeah.
So yeah, it is a shift.
It
It's
is.
it's
It
a little bit
is.
of a confronting your culture actually
Yes.
to
Yes.
Yeah.
step away from that. It really is. Yeah.
And you
Yeah.
make a good point, like when you talk about culture, the food is so intertwined with culture. It's like you you come and say, I'm just having plants, and you are you are an offense. And I've noticed that people will take it almost as an offense. And I'm like, no, I'm okay. You eat, what you're wanting. I'm not saying you have to eat what I'm eating, but people are so offended by it because it's so ingrained in our culture. Of how you eat, that no, you can still have a great time eating plants and you're going to feel better afterwards.
Right,
Yeah.
right. So knowing you grew up like that and you told us a little bit about um going away to college and you got a little more freedom and you were able to step away. Was there one thing in particular that just turned the tide for you that made the big difference or not really?
It was sort well, when I was in college, this is a weird story. Could not stay in the dorms for one moment when I was in nursing school. So I actually lived with this older lady. I mean, she was like 70 something.
Mm,
And we were an unlikely pair because she was a Caucasian elderly woman in Mississippi, and she and I were roommates.
mm,
That's another
mm.
story. But she but she cooked so good. Like, she made sure I had soy milk and peanut butter and banana sandwiches for breakfast every morning. And she would
Oh,
just do that for
mm,
me. And she would make a lot of vegetables. So like I said, you sort of see this gradual transition, I guess, with my life as far as the food. And I thought, man, I didn't eat a lot of this growing up, but this is good, what she's making. And when we would have meat, it would be like a Friday night event because, she's on a fixed income. It's not like she can pack it in like that. So she helped me out more than she'll ever know.
mhm.
Yeah.
Yeah,
Nice.
and she was not she did not overdo it when it came to food. We ate very simply, but it was satisfying. And so even understanding then that, man, her food seems to power me up more for my runs than what I ate when I was growing up. So,
Hmm.
it was starting to register.
Mhm.
Yeah.
Nice. Nice. Yeah, that's great.
So tell us a little bit about your kids. I know you kind of, and one of the benefits of eating plant-based was you wanted to um, help your pregnancy, but
Yes.
tell me about a little bit about your kids and traditional medical care and how you keep them healthy.
Yes, I have a 4-year-old and a 6-year-old, and you'll see me just smile endlessly because I just I'm just so like every parent is, right? The 4-year-old's name is Oneida. That's my little girl, and my son is 6. His name is Mark Jr. Mark Jr. was diagnosed with a developmental delay earlier on, and he has made such a great comeback. I had even gone to like a holistic doctor because my husband and I are so concerned about what was going on with him. And the holistic doctor told us, the fact that you've not had dairy in his diet has been beneficial for him, and he will be fine. And so he is doing well. The person I mainly want to speak to is my daughter. My daughter was diagnosed with sickle cell disease. If you know anything about sickle cell disease, it's like mostly African Americans have it. There are different types. She has the more severe form. Um, and earlier on, of course, we were scared. I mean, I had taken care of sickle cell patients in the hospital, and I thought, man, this can't be, our destiny for her. What else can I do as a parent to make things go better for my daughter? So we had sought out, the traditional place. We were in Chicago, and they were like, you got to go to this children's hospital. You go seek this care. You get this test run. And so we were just going through the ringer, but people were reporting less hospitalizations and more of a sense of wellness when they ate plant-based with sickle cell disease. And I thought, and sickle cell disease is a source of inflammation to the body. So if you can eat anti-inflammatory foods that have antioxidants in it, I mean, it's not rocket science, but this is not the thing that was pushed to the forefront when we would talk to the doctors and the nurse practitioners. Nobody was saying anything about nutrition. They quickly went to offer me the drugs. She needs to take this, she needs to take this. And I thought, okay. And as we continued to watch my daughter, or go visit, go for her regular checkups, they're like, hey, have you been to the ER? When was your last visit? When was the last time she was hospitalized? And so I'm noticing, these questions. I'm like, oh, this is an expectation. This is the
Mhm.
norm for a sickle cell disease patient. And so they just kind of look at me weird, and I'm like, no, she hasn't been, and I'm so thankful that she's doing well. I'm so grateful. But she has not had that same you know uh, thing that other sickle cell patients have had. So it needs to really be pushed to the forefront, and it's not. And yeah,
Yeah.
nobody's talking about nutrition. They're offering me the next drug.
Yeah.
Yeah, it's
Yeah.
amazing to hear you say that she hasn't had those, or she hasn't been in the hospital that much. Because my experience being in hospital pharmacy, I see multiple sickle cell patients, and they come in almost every month,
Yes.
or every couple of
Yes.
months.
Yes.
I've not heard. I guess I haven't heard one way or the other, but I'm imagining they don't know much about nutrition and how that can benefit them.
Yeah, it's not pushed to the forefront. It's not. It's unfortunate because really is life saving
Hmm.
for them to really have a sense of wellness. But it may not be financially beneficial to those organizations to push nutrition, because that's something I can get for free, or
Hmm.
Yeah.
spend
Right.
very little on.
Right.
Yeah,
Yeah.
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 I was
And
reading
I
about, go ahead. I'm sorry.
Oh, and I realize she's only 4. I don't know what else, is in store for her, but she's doing well, and we're so grateful.
So how does she manage the whole plant thing? Do you have favorite recipes for her, or does she help you cook, or tell us about your day-to-day life with 2 kids, plant-based?
They they're bold. They'll try whatever mommy's kind of cooking. And what I'm finding out with kids is that kids can still be very picky eaters. So every time they open their mouth, it has to count. So the bread we're buying, we're making sure, I buy 12 grain bread from Aldi, and if we're making peanut butter and jelly sandwiches, we're making sure it's the wholeness, the most nutrient dense ingredients. She loves lentils. I've been on this little lentil patty spree for a while. So she loves eating lentils. She has rice almost every day. I have these little things I make. I call them cookies. And so they have like chia seeds in them, cocoa powder. I have nuts in them. it's kind of like oats in them, and they love oatmeal. The kids have oatmeal almost every morning. So that's like a snack. So anytime I give them something, it has to count. You know, if that makes sense. But they start their day off with oatmeal. They have another snack. I'll fix some lunch, maybe pasta or beans and rice. They love beans and rice. We all do. And for dinner, you know, maybe some more of the vegetable combo. And we, you know, but it's like if they're hungry, they eat.
Yeah.
I think sometimes, you know, people can make it harder than what it is, and that's part of our culture, because if you haven't had beef, is what's for dinner. If that wasn't on your table, then you haven't fed your kids. But just being sort of natural with it. I mean, whatever they want, just feed it to them, but these are your choices, you know.
Yeah. Yeah, that's excellent. So we're gonna want those recipes for the cookies.
And I just flatten them and I say, these are cookies. Mommy, I want a cookie. Sure you can. Sure you can. And I have this little thing that I do with him. You're gonna like criticize me for my parenting, but if there's something new that maybe I want them to try, and if they've said, "Oh, I don't want any," I'll come to the table and I won't bring them anything. I'll just come with my big plate of veggies and rice or whatever I'm experimenting at the time, and I just eat it in front of them. And then after a while, they start to.
Get closer.
And I said, "Oh, you want some?" Like I had some pickled carrots and chickpeas and stuff the other day, and my daughter was like, and she just started pawing at my plate. And of course, I'm not gonna stop her. I want you to eat this.
Right? Oh, how funny.
So there, yeah, that's probably not up there on the parenting list. I just didn't feed them anything.
I think that's a great strategy.
Yeah, lead by example. There you go.
Or go hungry. It's up to you.
Right. Oh, this is all we have.
No,
There you
that's
go.
fair. You've seen that sign, you know, it's they usually have them like in a restaurant, you know, what's for dinner? You have two choices for dinner, take it or leave it, you know, like that. That's great.
Uh,
So you're homeschooling them. Have they ever
yes.
been in school, or they've always, I mean, they're still so little yet, but
They have been. They've been kind of in and out. Before we left Chicago, we were in a Montessori school, and when we moved here to North Carolina, I thought we're going Montessori again. But we live on a military base, so we went to the school on a military base. My son got a fever one day, and this is when the whole COVID thing was about to go down. And I'm like, you know, it just wasn't working because my daughter also was not able to go to the school. She was not old enough. And I found out when he was sick while he was home that I was like, oh, my day has a much better flow. I'm not stopping, taking the other kid to school. Maybe I should just homeschool.
mm,
And so, but it's easier because sometimes I'd send my son to school with a carrot and maybe a cucumber. So that already looks weird to everybody else in public school. You know, he
right.
looks
Yeah.
weird. And he told me one day that the teacher said, oh, he could only have one of the snacks. And I thought, he's plant-based, just let him eat.
Right.
And it's just easier. It's easier with the food. It's like, you know, if you don't have all your kids' stuff in a lunch bag package with 6 different cakes and candies,
Yes.
your kid looks weird going to school.
Mhm.
They do.
Yeah.
They look weird. Or the snack I have is probably gonna melt anyway. A lot of the plant-based stuff will melt if you don't eat it right then. And it's just easier for me. It's just easier
Mhm.
being at home with them. I don't know what the future will hold. I'm certainly not opposed to public schooling, but things are going well for us. It's working for us right now.
Mhm. Good.
Good.
Yeah.
Yeah.
Good. Mm.
So, what would you say is the biggest challenge you see for children's health now?
I guess I have to say the obesity epidemic because that's what everybody else is saying. And really it's yeah, that breaks my heart when I see, you know, kids in Walmart and they're heavy and they're not able to move around. That breaks my heart. It just because it doesn't have to be that way. And then, you know, you look at the parents, and the parents obviously are overweight as well. And it's just a knowledge deficit. And sometimes it's where they're located, because of where you live can determine your health. And it
Mhm.
just that stuff that breaks my heart, because they should be active, they should be moving around, they should be, going to parks, and it's unfortunate, but it's a knowledge deficit. I especially have a heart for those sorts of communities that are, underserved, and being able to bring like food for life classes and things to them, because it just, it doesn't have to be that way.
I was reading an article today about the one of the local school districts, and they were talking about the different um, challenges that the school districts face, and putting them in order. And nearly everything that they reported as a primary, at least health concern, had to do with food. Every
Hmm.
single one.
Mhm.
Yeah. So it was
Hmm.
obesity, and it was like ability to sit and focus, and
Yeah.
um
Okay.
I can't even remember the other two, but I really thought, like, if they could just get the food stuff handled,
Yes.
because this
Yes.
particular school district is challenged
Mm.
by low income levels and things like that. So the kids are, let's say, 80% of them eligible for free or reduced
Oh.
lunch.
Mhm.
And then
Mm.
what gets brought in is, thank goodness they're getting something to eat, but
Ugh.
it's not what you would feed your children, that's for sure.
Mhm.
And when you talk about that free lunch program, I was, that was me growing up. Had the free lunch program, and again, like I said, I talked to you about my mother getting the government assistance, and so for people who are already underprivileged, and yet free lunch is supposed to be a good thing, but yet I'm going to get more processed food. It's
Right.
like my health. It's just a downward spiral, and you can't really bring people up and get them to be healthier and get them to be productive if you're still giving them the wrong stuff.
Okay, so how would you advise parents and educators, or what would you advise them to do about children's health?
Let's offer more plant-based options. I realize that making a whole overhaul, which is kind of what Michelle Obama was trying to really get done in the school system, may not work, because I've heard that they've sort of reverted back, that a lot of those things that she put in place have been undone, which is unfortunate. But just offer them those plant-based options. I even tried to get with the school here to see if I could do like a food for life class there. So just exposing them to these foods, because I think about kids, man, kids will surprise you. They kind of like it simple. They like it simple. They they're more, they're still at that age where they're sort of malleable, if I can use that
Mhm.
word.
Mhm.
So they can adapt. Like my son, like I said, he went plant-based when he was 16 months. And of course my daughter, I was 7 months pregnant with her, so that's kind of what she's known. But if you get them early, they can adopt those sort of healthy behaviors. And of course, if we're role modeling it. So getting those people in the school, getting people to work alongside the school nurses, that could be a way that people could step into the school system, and just offering those classes to the schools, just exposing them, doing our cooking demos, doing our interactive classes, because the kids just need that exposure.
Mhm.
Yeah.
Have you had any success getting into the school system, even to do the cooking classes or to talk to anybody about it?
I have not. I have not yet on base. I am working with a homeschool group that I'm going to do the kids health series
Nice.
class with, and
Mhm.
that's getting a lot of traction. So I'll start there and then try to work my way into the public schools.
Mhm.
Mhm.
Yeah. The public school environment is very tightly wrapped, I'll say. Because the food is carefully defined, what they can give and what they can't give. Like one of the categories, let's say, is milk, right?
Hmm.
Milk must be offered.
Mhm.
Must, must. All right. So it's either,
Bothers me.
I know, I know. Well, when we go back to what we were saying before. Okay, let's say 80% of the population actually doesn't digest milk well at all.
Yeah.
because we're not supposed to, because we're not babies anymore, and we should have weaned off it a long time ago. And besides that, we're not cow babies anymore,
Yeah.
ever. Were we ever a cow baby? No. And yeah, so it's not really, yeah, you already know. But that is one thing. The milk must be offered, and in some cases, it is just plain given, period. A lot of it gets thrown away. And actually, we were looking at, yeah, you and I were looking at that, the statistics from the USDA and the way that a look at the way Americans eat. And if you look at those statistics, it says that Americans don't drink nearly enough milk.
Yeah.
We don't. There's like an expectation. Actually, there's like a daily allowance you're supposed to get of milk that makes people sick and that you didn't need in the first place.
Yeah.
So yeah, that's one thing. And then the other thing related to milk is they do allow one non-dairy milk alternative, and that's soy milk. It has to be fortified. But generally speaking, I think they don't provide the financial support for the school system to cover the
Okay.
non-dairy milk.
And the
Almond
thing
milk
about
is not acceptable.
That's
Cashew milk, no.
It's
Oat milk,
crazy.
no. Only fortified soy milk.
It's like there's this abandonment of the facts because we got to keep the milk on the table. And
Yes.
I mean, and actually, 1 cup of soy milk in a cup is not that big. I mean, it's very small. 1 cup of fortified soy milk offers 30% of calcium that a child needs on a regular basis. I know my kid can at least put down 2 or 3 cups.
Yeah,
So
sure.
they can get it in, and then all the other plant-based sources of calcium, tofu, the greens, the kids can get it in, but it's just like they're abandoning their thought process and just like, oh, we got to put this pasty stuff on the table that the kids don't really like to drink anyway.
Yeah.
Right.
You know.
It's going to go to waste, a lot of it. Yeah. Except for the cheese. The cheese generally gets eaten.
Yeah.
Yeah.
Oh, the cheese. And that was another thing we were checking out when we had relocated here. I thought, well, let me take a look at the school's menu. Cheese pizza, chicken nuggets with macaroni and cheese,
Yes.
cheese mozzarella sticks, of course, with cheese. And I thought, man, this is not going to go well for me.
Right.
So my son only had to stay in for a few hours and I could provide him with a snack. But of course, as he went into the upper grades, he would be exposed to this cheese.
Yeah.
And so that just, like I knew I just knew it wasn't working or going to work.
Yeah.
Like I said, we just have an easier time just me feeding them here. And I don't know. And I would like to hear what other parents who are plant-based are doing with their kids as far as the school system.
Yeah.
They get exposed to so much.
Yeah. I know a lot of the parents that I speak to are either sending the lunch with the child,
Mhm.
or at some point, of course, the child gets to be, call it 13, 14, 15,
Mhm.
and they want to be well integrated into their peer group,
Yeah.
and the food becomes a bone of contention, for lack of a better way to
Yes.
put it,
Yes.
Yeah.
And that's why we were going to choose Montessori when we came here, because Montessori is more open. All the kids bring their lunches. There is no, cafeteria set up. So that's something that I really wanted to do, because I was like, okay, just like Mira was saying, they wouldn't have to be exposed necessarily to the culture of the setup of what everybody else is doing. It's like everybody brings their own lunch. But Montessori school prices, and then thinking about sending both kids, that's not really working.
That's
Yeah.
right. That's a
So
lot.
that
That's a lot.
so that's another reason that just we made that switch. But I have found a few things that really work for my kids when I see them shifting or not wanting too much. I mean, they can now, they're sort of aggressive now with people who eat cheese in public, and so we're trying
Wow.
to tell them to tone down, especially my son.
So what
Like
do
we
you
were
mean he's aggressive? What does he
they're
do?
they're a bit much. And like we were going to Washington D.C. and he said, "Mom, you need to bring your business cards just in case the people there eat cheese." Like in one minute we were in Old Navy and he went up to this just random stranger. Do you eat cheese? And I'm just like, son, we can't really do that. We
Simmer
we want to
down a
be
little bit.
gracious with people too. So he's very vocal. And
Okay.
he does help me in the kitchen sometimes. They have helped me make some of the meals. So that's a strategy I know people could use with their kids, those who are trying to get their kids to eat more plant-based. Another thing that I have found out with my kids is kids love things in packages. Um, so like if I buy, the grape tomatoes or cucumbers or carrots, I would just put them in little Ziploc bags. And so if we're in a hurry, we're on the go, we got to go to some event, I just grab some of those baggies or peanut butter and jelly sandwiches and just take them with us. And of course, as a family of four, we're saving tons of money, right?
Yeah.
So I'm motivated. I'm highly motivated.
Right.
But they love stuff in packages. We can be riding and those carrots may not maybe they didn't sound too appealing at home, but if you're on the road, you want some carrots. Sure, I'll pass
Yeah.
you some. Like last night, they said, "No, I'm not hungry." I said, "Oh yeah." And so I had put some lentils and rice together, but we're riding, we're on the road. You're gonna get hungry. You know what? All I have are lentils and rice to offer you. And so they'll eat it. And I do educate them about the food. I'm like, this is going to last you. This is going to help you to play longer and jump higher when you're at the park. These foods satisfy. And we even have this word in the house where we'll say, well, that other stuff is not real food. This, what I'm feeding you, beans and rice, the lentils and rice, this cookie that mommy made, this is real food. So they're starting to use those terms now,
Mhm.
which is really good. And sometimes, like I said, if you limit what they can have or limiting their choices, they'll eat it. They'll eat it. I mean, they're kids, and what are they gonna? And sometimes if they say no, I say you don't have to eat that, honey. Don't worry about it. An hour later, Mama, I want some beans and rice. Oh, I'd be I'd be happy to fix you some. So they're getting it and they know that those things are going to make them feel good. So I just keep reinforcing, but they'll run the
Yeah.
business soon, I'm sure.
Yeah. But I think that's pretty important for parents to realize. Don't underestimate kids. I mean,
Yeah.
don't think that
Yeah.
you aren't going to feed them these foods because they're not going to like them. Give them
Yeah.
the chance to try it. And
Yeah.
yeah, don't decide for them. I
Yes.
think that's
Yeah.
half the fun is, letting them explore and experiment with different things. And so they
Yeah.
might not like everything, but
Yeah.
you don't know
Yeah.
that until you try. But I think
Yeah. And they
majority of it
won't.
they probably will like.
Yeah. Like today, and one thing that I like hate to waste food. I hate to waste it. We're a military family. We don't like to waste anything. Um, so today I experimented with some cream spinach and I told my son, hey, I'm making some cream spinach over here. I said, do you think you'd like to try some? Yeah, Mom, I'll try some. So I just gave him a little bit because I'm thinking my husband and I are going to eat this. um, but he liked it, and just not giving them a big plate of something, that's another strategy that I do. I'll just give them a little bit because I want to whet their appetite and have them to come back for more. So I don't try to give them a big bowl of anything. I want them to come to me and say they want it. So
Mhm.
sometimes, limiting those choices or saying, we're on the road, this is all I have. But they come knocking later.
That's great, Tara. That's great. We have this conversation frequently about, so many kids, it starts so young, right?
Mhm.
The training of the palate. So I'm going to take it back even further.
Yeah.
We were talking to a lady some weeks ago who is a dietitian from India originally,
Mhm.
and she was telling us about in Ayurvedic medicine and traditional Indian practice is the pregnant woman eats all different wide variety of flavors and spices and peppers and all kinds of stuff, wide variety during the pregnancy. And then again, still when she's breastfeeding, wide variety, all the curries and the
Huh.
garam masalas and the everything like cumin and all of it, black mustard seeds, all of them, right? Cardamom, all of it. And all that goes through her breast milk. Peppers through the breast, right? So the baby is getting this wide variety of flavors all through the breast milk, right? Because all that stuff certainly flavors the lactation fluids, right? There is no, when the baby does start to take solid food, there's no toning down of the spices for the baby.
Yeah.
The same peppers that the mom is eating, or the same level of, cumin and coriander and all of that stuff, is what the baby gets, just in a mashed up smaller amount, right?
Wow.
Yeah. So when we're training a child's palate, it can start from that young, right?
Yeah.
In the United States now, we train the child's palate very often toward like a milk-based or soy-based formula. And then it's trained toward jarred baby food. And then they're trained again toward chicken nuggets and French fries,
Oh,
right?
Yeah.
yeah.
It's so common how it goes, chips and stuff, and it starts that young. So if you're training your child that way, and somebody came in your house, or the babysitter arrives and says, "I'm making lentils and rice for dinner," the kids are going to lose it, right? Like, I don't know what that is. Like, that does not match anything I've ever had.
Yeah.
One of the other things that people face too is how, like in some neighborhoods, there aren't grocery stores. I know, who was I talking to the other day that said he's in an area where people frequently shop in gas stations,
Man.
So yeah, that's tough. That is tough.
Yeah,
That's
it's like
why,
we're not so rich after all. America's
right,
not so rich,
right. Well, certainly not in certain neighborhoods. Certain
Ah,
neighborhoods are, yeah, definitely challenged by that.
yeah. So yeah, like I said, I do have a heart for those communities that are underserved and just exposing them to this. So I do teach a lot about canned goods because I'm trying to tell people that you don't have to be wealthy to do this. Like the Facebook group that I'm doing now, I'm like, hey, it's winter time. I'm eating a lot of dried goods and a lot of my stuff is frozen right now. So I try to always spin out something about money because that's a concern to people.
Yeah.
But man, people in the underserved communities, it's just the poverty thing. It just spirals down, spirals down. And let's not even talk about us as healthcare providers, how those people are treated when they come into the hospital, because we can try to say, oh, we're going to look at people just the way they are. We're going to treat everybody the same. That doesn't happen. When those people walk in and they're obese, and they have other things going on, and then if they look a certain way, no, you're getting treated differently. So
Yeah.
this lifeline that I'm trying to throw out to you about plant-based eating is doing more for you than what you think. You know, it helps people on so many levels, and then just being able to get up in the morning and feeling good. I want to feel good. I have a lot on my plate. I have kids that I'm teaching. I have a business that I'm running. There's a lot to accomplish, and I need to feel my best to get those things done. I want to feel good. I want to look my best. It's a lifeline for those folks in those communities.
Yeah.
That's really very deep.
Yes.
Like seriously,
I'm getting a
seriously.
platform to tell people how I
You
feel, so
are,
Yeah.
thank you.
thank you. Thank you for saying that. I've
Yeah.
never had
Yeah.
anyone explain it quite like that.
Yeah, it's an interesting way to put it. Yeah.
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 Thank
I
you.
even think
Thank
too,
you.
like you said, it's not only an African American community, right? It's
Yeah.
actually everywhere, all
Yes.
across the country,
Mhm.
everywhere.
Yes.
It
Yeah.
Yes.
doesn't matter the zip code, the socioeconomic
Yeah.
status, it doesn't matter.
Mhm.
Now, of course, it's harder in a low income area,
Mhm. Mhm.
and
Mhm.
certain zip codes are certainly harder hit than
Yeah.
others. Um, Tell me something that gives you hope when you're looking at this whole thing and you're looking at those precious babies of yours. Tell me something that gives you hope.
people are changing. People are becoming woke, if I can say that.
Mm,
And the tides are changing. Like the folks that have reached out to me about plant-based eating, and people are getting it. People are understanding that this machine or this food industry is not being good to them.
mm,
And so they're starting to understand. They're wanting to try more plant-based options. And so what a wonderful time it is for myself, for you guys to be on the move, because people understand that, man, they do have more energy.
Mhm.
She doesn't look like that other 60-year-old woman that's plagued with these chronic illnesses. It is the food. It must be the food. People are getting it now. And so I'm encouraged by that. I'm encouraged.
thanks.
Yeah.
Yeah, us too.
Yeah. All right. So, what is one thing that our audience could do right now to get started if they want to learn more or just make one change?
To make one change, I would say cut out the cheese. I would say start with the cheese. The cheese is so detrimental. It's really just bacteria decomposing. Is void of fiber. It's loaded with cholesterol and sodium. If people could just stop the cheese, they would see a difference in their waistline, their skin, their sleep pattern, and that could make them more inclined to keep going. I would say eliminate the cheese.
Yeah.
That's one thing that I get my clients to start on. That's the first thing we start with,
I think that's
cheese.
great because I feel like, at least from people I've heard, that's one of the things that people hold out until the end because
Mhm.
they just can't do it. So why don't you start with the hardest thing first?
Yeah. Yes. Yes.
And then
Yeah.
everything else will come naturally after that.
Yes. Yes. Because it's so addictive. Like that
Mhm.
same mechanism that allows people to be addicted to morphine is the same way in which they're addicted to cheese.
Yeah.
So
Yeah, for sure.
All right. So if people want to find out more about you, how can they learn more? Where can they go?
You can check me out on Facebook. Facebook is where I do most of my activity. You can reach out to Tara Cannon LLC. I will message them back within 24 hours. I have a Facebook group, Health and Wellness for the Believer. They can reach me there. I have a website, www.taracannonllc.com, and there is more contact information there. I'd be happy to help them reverse their illness by being plant-based. I'd be happy to serve them.
Sounds great. Yeah, we'll be able to be sure to put all that information in the show notes so people can
Thank you.
get in
Thank you
touch.
so much. Thank you so much.
And don't forget, not only does Tara do plant-based eating coaching, she also does nurse tutoring. So don't forget that part. Thank goodness you are a healthcare professional who's enlightened. We appreciate that. We totally appreciate that.
Yeah.
Yes. I love sharing the evidence with people, just saying, well, this is what the research studies say, this is legitimate because this many women did this and this is what happened. So I love sharing research, love sharing that.
Yeah.
Excellent. Excellent. Well, thank you so much, Dr. Cannon. It has been a pleasure
Yeah.
chatting with you and
Such a great discussion.
yeah, right. Spending time with you. Wonderful. And for our audience, we'll see
We'll
you
see you
next
next time.
time. All
Thank you
right.
guys for
Thanks.
having me.
Have a good night. 6 Million Seeds is made possible by the generosity of Bruno Chiropractic, Acme Construction Metals, EXP Realty, and Deck It Out Builders. We thank you for your support.